And it is National Osteoporosis Day. Dr. Jamie Seeman is an OBGYN surgeon, former Miss Nebraska and Titan Games competitor, and now author of Hard to Kill. It's a book on achieving optimal health through nutrition, movement, sleep, mindset, and environment. You juggle a lot of hats. Dr. Seeman, good morning to you.
It's so wonderful to be here. Good morning.
It's wonderful to have you. Okay, so we know keeping our bones healthy is one thing, but it is imperative for women who are postmenopausal. So why is this?
It's so important because as we age, we lose our bone mass. So even as early as age 35, we start losing our mineralization and our strength of our bones. And today is World Osteoporosis Day, and I'm here to raise global awareness on the prevention, diagnosis, and treatment of osteoporosis and metabolic bone disease.
And I know growing up, it was just, I had my parents saying, drink more milk, drink more milk. It's going to keep your bones healthy, but I'm sure there's a lot more to it. So what are some factors in maintaining good bone health?
Yes, there's definitely things that we can do to reduce our risk of these bone-related diseases. And the first one is really staying active. So doing weight-bearing exercises, not simply just walking, but actually using resistance training as a way to put stress on the bone. And then reducing stress in our lives. We live such a fast-paced life, and we need to reduce stress because stress is bad for everything, not just our bones, but really all of our organs. And then a really important strategy is nutrition. So the food that we eat really matters when it comes to bone health. Eating adequate amounts of protein and eating adequate amount of minerals like calcium. Everybody thinks about calcium when it comes to bone health. But there's actually one thing a lot of people probably haven't thought about when it comes to bone health, and that's getting adequate collagen in the diet. And so intake of collagen is super important because collagen is the most abundant protein in bone. Specifically, a collagen called FORTIBONE has been studied to help with improving that bone health and bone-related diseases.
Okay, that's interesting because I only started learning about collagen in the last couple of years. So in terms of food and natural resources, what are we reaching for here?
So, collagen does come in food, animal-related products, but you can take it in supplement form in a powder that you mix in a drink. And a lot of people think about taking it for skin, hair, and nails, but it's actually extremely important for bones because the collagen gets laid down in the bone and it gives a framework for that mineralization to occur.
Okay, interesting stuff. We learned something new today. So you've written a book as well. I mentioned it at the top of the interview. What's it all about?
Yes, I've written a book called Hard to Kill, and it's basically solutions for you to incorporate into your life to make yourself basically harder to kill. So it's strategies about nutrition, things like taking collagen, exercising, reducing stress, and reducing chemicals in our environment.
All right, great stuff. Thank you so much for your time this morning. Lots of expertise. That book, of course, available in bookstores, on Amazon. Thank you again, Dr. Seeman. Have a great day.
Yes, thank you.